Gastric bypass surgery is the first choice in bariatric procedures for many patients with chronic diseases associated with obesity, hiatal hernias, and gastroesophageal reflux disease. The procedure consists of making a small reservoir in the stomach called a gastric pouch and bypassing a portion of the small intestine by forming a shorter, similar functioning intestine through which food will pass. Consequently, due to stomach restriction and decreased absorptive capacity of the intestine, this will result in loss of excess weight. This is a minimally invasive procedure done through tiny incisions. This allows the placement of trocars through which the specialized instruments will pass through the body to perform the surgery. Ciba is renowned for being the only team that performs an endoscopy before and after surgery to ensure our exceptional care. The initial endoscopy is to aid in determining if each patient is an ideal candidate to receive a gastric bypass surgery. Subsequently, the small intestine is cut. The proximal part is joined with the same intestine in a distal direction towards the large intestine to connect the pancreaticobiliary juices. The distal part of the intestine is then reconnected with the gastric pouch to reestablish the natural passage of food. Once performed, we use high-tech surgical staplers, which release 6 lines of high-grade medical staples while cutting with a center blade. This method is proven to be very safe, helping to avoid leaks and bleeding. We then perform the second and final intraoperative endoscopy. Here, we check the seal for abnormalities and alignment. This review allows us to rule out any complications that may arise. Finally, we reinforce the stapling line with external sutures on the stomach, remove the excess stomach, and place a drain. The drain will help during the hospital stay so we can detect the presence of any internal bleeding, which, if detected early, is much easier to resolve.